I'm Sara, founder of Skin to Skin, and welcome to Skin to Skin Face to Face, where we do a deep dive on the most frequently asked questions around trying to conceive, pregnancy, breastfeeding, and postpartum. I'm joined today by our amazing medical advisory board, Professor Caitriona Ryan, who's our consultant dermatologist, and our GP advisor, Dr Raj Arora, and beauty editor, Bridget March.
So today I think we're going to talk a little bit about hormonal acne, breakouts in pregnancy and postpartum. Hands up who experienced that in their pregnancies.
Yeah, very much so.
I've got three, and my first pregnancy, I had acne for the first time in my life. And I was like, I write about how to deal with this, but when you have it on your own face, it's very different. It's very hard not to touch it and, you know, all those things. And yeah, it was a real kind of education for me, learning about kind of how your skin can just completely change overnight. How about you guys?
Yeah, so I did struggle with adult acne anyway, and I feel like I just got on top of things. I was really proud of myself, and then I got pregnant, and then the progesterone levels came up, and suddenly, boom, I had all this acne in the typical areas on the jawline, you know, a little bit on the forehead. And initially, I just kind of thought, I had nausea and vomiting. I had everything else that comes with that early stage of pregnancy, and I just didn't have the will. I was like, you know what, forget it. So, and then I thought, no, I've spent years fixing my skin. I need to get on top of it. And that's when the search started for pregnancy safe skincare. Obviously, there was nothing like Skin to Skin out there. It was a struggle. I am obviously a GP anesthetic doctor, so I have a clinic. So it was helpful to be able to get this, you know, ingredients off the shelf that will be helpful for me. So I could use things like the azelaic, I could use low dose of salicylic, I could use the benzoyl peroxide, and I did get on top of it, but it took a long time and definitely affected my self-esteem during those early months, I would say.
Yeah, it's hard, isn't it? Because it's like you're almost being brought back to puberty again. It took me years to get over my acne, probably up until I was 25. And then I literally just, you know, skincare was my holy grail. I didn't change anything up until 6 months pregnant, and because obviously realized then I couldn't use most of the things that I couldn't use. But it's mad how quickly it changed. Literally the day I got pregnant, my skin went from I could put anything on it to it was so red. Like I had burn marks all around my eyes from which I know is from the high levels of retinol I was by mistake using. Right. But it's just crazy how much it's changed, and actually it's never gone back.
No. So what is it? What's going on in your skin, in your body that's kind of causing these changes that just happen overnight, like you say?
It's the hormonal shifts, you know, and particularly the progesterone. And that's why we see it even in people who are on their fertility journeys with IVF, you know, when they are given the hormonal drugs and that surge happens, it can break people out into really devastating acne. And the thing that's devastating for us as doctors often is when someone's pregnant, you don't have the same tools to hand. So the usual, the usual oral medical treatments that we would use to treat really severe acne, like isotretinoin, Roaccutane, or the tetracycline antibiotics we cannot use. So, or certain lactone can't use. So, there are certain antibiotics that we do use, but they're not in any way near as effective. And skincare is really, really important here. And we do see people left with really bad scarring after that pregnancy. Acne, my partner actually, a consultant dermatologist that I own the Institute of Dermatologists with, she has terrible scarring because of the acne she got for the first time ever during her pregnancy. Now we've helped her with lasers and that sort of thing now, but you never really get rid of the scars completely. And then postpartum, people can have really, really bad flares again. And again, it's the progesterone and the shifts. It is.
It's a shift. And I think if you're a woman of colour, and I think, you know, speaking for myself and anybody else watching this, it's really important that we recognise that melanin anyway, the pigment in our skin is so reactive. For us, you know, if you pick a spot, you're likely to get pigmentation, which is going to be darker and deeper than if you've got lighter skin tones. I think I got melasma in pregnancy, but also having the acne meant that even though I got rid of the active acne, the scarring was there, and it was there throughout pregnancy, and I couldn't use hydroquinone, I couldn't use skincare that you normally would to quickly tackle it and get on top of it, and it affects you. You know, your body's changing, you don't recognize yourself, and then you have this skin that's breaking out and awful and irritated, and it can have a huge impact. And I think if I had tools to hand that, you know, I knew were going to help me prevent that, I could start them during the time that I was trying to conceive, I think my journey may have been a lot easier.
I really think that too. Like if you can use sort of preemptive skincare, like skincare that will keep your barrier stable, you know, the azelaic acid that you said you used, you know, in your skin to skin, the azelaic acid derivative is even better because it doesn't have the irritancy that we see sometimes with azelaic acid, particularly in Celtic skin. So to have those sort of anti-inflammatory components that are safe in your skincare, nicotinamide as well, niacinamide is excellent. Hyaluronic acid has anti-inflammatory properties as well. So using all of these things to keep the inflammatory activity down can help a lot. Post-inflammatory hyperpigmentation can be absolutely desperate because it can look like someone has the acne still until you realize that the pimple is gone. They have that mark that will take months to get rid of, and actually azelaic acid will help with that mark as well. It's good for pigmentation, but it can be it can be a real struggle at a time that you're already so highly emotional. That if you can do anything to stop it happening in the first place, that really is the you hit the jackpot then. But coming in behind it, if you do have unstable skin, and using pregnancy safe ingredients can make a huge difference, because we're so limited in what we can give a patient.
So oral medications pretty much off limits, retinol off limits, which can be used to treat acne as much as anti-aging, that's off limits, isn't it? What else would we say are definite no-goes for treating acne?
High doses of salicylic acid are a no-go.
So above 2%?
Yeah, above 2%, definitely a no-go. And other acids as well, like the glycolics and things in high percentages, again, I wouldn't be using that. Caitriona, what do you think?
Same, and the other, and benzoyl peroxide at low levels is, should be relatively safe, but the problem is your skin is so sensitive and highly irritable that those things can actually irritate your skin, so cause sort of red scaly rashes and stuff.
Well, that's what I had. So I then used benzoyl because it was at lower doses safe to use, but then the skin got really red, so then I was chasing myself with barrier control. So actually, you're right. There's it's a bit of a minefield, isn't it? Because there are a few tools we can use, but it's nowhere near what you can do when you're not pregnant.
But there's also like a lot of misinformation of what you can and cannot use in terms of, salicylic acid we've touched on. Yes, you can use it. It's just not the high percentages. But there's quite a lot of other acids that, again, you can use. But, sometimes you can have a reaction. I had a reaction because the percentages were so high. But it's the kind of, it's making sure that it's, a considered amount of active ingredients in there, the right percentages.
Exactly, really, really important.
What about postnatally? So, I'm breastfeeding at the moment, I'm tempted to get back on the retinol, but I'm not, because I understand that it might not be breastfeeding friendly perhaps, but the jury's out, isn't it, in terms of if I'm treating breakouts, what would you go to when you're breastfeeding?
I don't think the jury's really out on that one. Well, certainly I completely allow retinols in the postpartum period.
Do you?
Amounts that, that you would have in your bloodstream, systemically, so to get into the breast milk is so negligible. The RID, like the RID, relative infant dose, is safe.
The issue, though, that I find with that, Caitriona, is that so I agree, I would say if patients come in particularly with a lot of acne postpartum and it haven't cleared it and they're lots of, hyperpigmentation, I will prescribe them. I think the problem, though, is that they often get the leaflet out and they'll start saying, this says it's not pregnant, it's not breastfeeding safe. And I've had a few patients come in a complete panic saying, you've prescribed me this retinol, whatever, and it's not safe. And I think therefore it's really important to educate that I'm giving you this, the leaflet may say X, Y, Z because there's no safety data on it. But I have to take it's a partnership. I have to say, how do you feel about this? This is something you can try with consent. We can work on this together. I can give you this. But, again, although you're right, there's no real evidence sure it's going to be in the breast milk. The problem is it's about the whole conversation we had before about risk versus benefit and what's, erring on the side of caution. But with breastfeeding, there's definitely more room for movement, I think,
We do have LacMed, which is really, really, really helpful tool for us to tell us. LacMed is it's sort of a directory of what is safe in breastfeeding. And I think this is a really important point as well. Breastfeeding is such an important part of the pregnancy experience for so many women, but because of all the misinformation out there, I feel like women are almost punished for breastfeeding in some ways. You can't do this, you can't do that, you can't, you know, have good skincare. And I think it is important that we try and educate people in, because what worries me sometimes is that people might stop breastfeeding prematurely so that they can get back to things when actually they would have been okay to continue on and get back on their retinol and do whatever else. Like we use retinoids in babies sometimes, you know, rarely, but we do. So, I mean, once the baby is born. So we have data on use of topicals in kids as well, you know, for certain conditions.
Is that for like acne? Newborn?
It's not for and nobody ever
don't
use your retinol on your baby. No, it's for other types of conditions to do with keratin production, so chronodermas and things like that.
So you know you have data on that. And that's the thing. I think education is key. It's not that it's off limits necessarily. It's more about educating the patient so they understand. Okay, I'm not going to freak out when I read this leaflet because my doctor has told me X, Y, Z, and I understand this is the data on it, and they can go and I send them away and say, go and have a read about this if you're at all nervous, and then take it from there. So
it's interesting because, like you say, you know, if you've spent a long time trying to conceive and you've been cutting things out, and then when you're pregnant you're cutting things out, and then breastfeeding, it, you know, it's hard on a mother to constantly feel like you're sort of, you know, depriving yourself of what you might want to otherwise do, and you don't know what's safe, and there's a lot of scaremongering.
And especially when it could be safe, I think it is the other thing, because people can breastfeed for up to 5 years sometimes.
Well,
I'm still breastfeeding. My daughter's almost 2. I can't get her off them, but my skin, as soon as I drop feeds, my skin goes up again, flares up immediately.
And that's your hormonal shifts.
It's so hormonal.
It's the seesaw.
And it's trying to, you know, tackle the kind of breakouts, but, you know, obviously I'm being a bit biased because it's my products, but since I've been using the skin to skin products religiously for the past 6 months, probably plus now, I've not had one breakout. And you can definitely feel my skin gets a little bit more sensitive around the time when I drop feeds, but the breakouts are gone. Completely gone.
So you're breastfeeding to treat your acne?
Exactly that. I like it. So let's talk about what are hero ingredients for treating acne when you're pregnant and breastfeeding, because for me azelaic acid was really a saviour in my first pregnancy that I stuck with or returned to for my second and third pregnancies. But what are your heroes?
So azelaic obviously is a hero. If your skin can tolerate it and you're not too sensitive, a low dose benzoyl peroxide can help.
What kind of percentage are we talking low dose?
So 2.5. Is that what you normally go for?
Yeah, I wouldn't go any higher. No higher than MOT, you know. And certainly
like over the counter, you know, and sometimes you get them with something else, like, you know, to help reduce the inflammation in them. So you get these preparations like in Boots, which are a lot lower. So I will often say, try something like that. That's what I used on myself. I did get sensitive with benzoyl peroxide, so just to put that out there, I did. Yes. So it's not my first step to go to. I think azelaic, if you can tolerate a very low dose of salicylic, like your wash, for example, can be like a 2% salicylic acid wash. You might not use a toner or a serum. That might be enough first of all to cleanse the skin, then going into things like azelaic. I think with skin to skin, the good thing is it is a derivative. So where you might get more irritation from the actual azelaic acid, even over the counter doses, this will help to combat that. So those two things helped me per se, but it might not be the right thing for every single, you know, it's a very individualized approach, I'd say.
Yeah, I think it's different for everyone, and especially if there's a skin barrier issue thrown in there as well. You know, when I prescribe to patients, what I prescribe is erythromycin orally, if I have to do something, and then azelaic acid is the only thing we can safely topically prescribe. So when you can have that already in your over-the-counter skincare, azelaic acid or a derivative, and actually, as I said before, the derivative is great because it doesn't have irritancy, but definitely niacinamide, hyaluronic acid, and not. I think a lot of people have the misconception that when they have acne, that they shouldn't use a moisturizer because that's going to congest them, or it's going to. I think they think that their skin is producing too much oil, so why would you add something? Hydrating is very, very different. So making sure that your skin is well moisturized and that your barrier is repaired without congesting it is key. And actually, when your skin isn't being moisturized, your oil gland's going to overdrive to try and replace that.
Yeah, more acne.
My skin gets worse when I'm dehydrated, especially with breastfeeding in the early days when you're doing loads of it. like I would drink liters of water, didn't feel like I was doing much. But if my skin was dehydrated, that's when I would break out, especially on airplanes.
Yeah.
Airplanes.
Yeah.
Yeah. So I think you've got every ingredient that I would want to put into an over-the-counter prep, and I think keeping the skin stabilized and never over congesting it, I think is really where you need to go.
Yeah.
So have you got any other top tips just to end with, sort of thinking about acne in pregnancy and postpartum? You know, like you were saying, don't skip the moisturizer. For me, it was don't product hop and try lots of different things. Consistency was key. Stick to a routine. Anything else? Any other top tips?
I would say if you're struggling, go and get help, because you might just need that antibiotic that is safe. You know, so don't just keep hopping on the shelves. If you are using something like skin to skin and it's not quite touching it, because that could be a possibility as well, you know, in rare cases, then obviously go and see your derm as well.
Absolutely agree.
Yeah, and I think as well, just making a simplified regime, not going crazy with, you know, obviously when you're wearing makeup, you want to do a double cleanse, but, you know, in the morning, you don't need to do a double cleanse. So just simplifying it and just really giving your skin a break is what I felt most difference from changing things up in my skincare regime.
And who's got the time when you've got little kids anyway?
Oh my God, tell me
keep
about
it simple. Keeping it simple.
Yeah. And we do see that the people are trying so hard to make things better, they're actually personally making it worse by, as you say, adding more and more and more, and ending up with an acne cosmetica. Yeah.
Keep it simple.
Yeah.
Cool. Thank you so much.
Well, thank you so much, ladies, and I hope you enjoyed this episode of Skin to Skin, Face to Face.